What are kidney stones? Kidney stones, also known as renal calculi, are hard deposits of minerals and salts that form inside the kidneys. They can vary in size, ranging from a grain of sand to a golf ball, and can be composed of different materials, including calcium, uric acid, and struvite. Kidney stones form when urine becomes too concentrated and the minerals and salts in the urine crystallize and stick together. Some people are more prone to developing kidney stones due to factors such as family history, certain medical conditions, and dietary habits. Kidney stone symptoms. The symptoms of kidney stones can vary depending on the size and location of the stone. Some people may experience no symptoms at all, while others may experience severe pain and discomfort. Here are some common symptoms of kidney stones. 1. Intense pain in the back, side, or lower abdomen. This is often the most common symptom of kidney stones. The pain may come and go and may be accompanied by nausea and vomiting. 2. Painful or frequent urination. You may experience a burning sensation when urinating or feel like you need to urinate more often than usual. 3. Blood in the urine. Kidney stones can cause small amounts of blood to appear in the urine, which can be visible to the naked eye or detected through laboratory testing. 4. Fever and chills. In some cases, kidney stones can cause fever and chills, which may indicate an infection. Call a doctor if you are experiencing symptoms of kidney stones, such as intense pain in the back, side, or lower abdomen, painful or frequent urination, blood in the urine, or fever and chills. You should seek emergency medical attention if you experience severe pain, difficulty urinating, fever and chills, or if you notice blood in your urine. Kidney stone causes and risk factors. Kidney stones can form when urine becomes too concentrated and minerals and salts in the urine crystallize and stick together. Some factors that can increase the risk of developing kidney stones include family history. If a family member has had kidney stones, you may be more likely to develop them. Dehydration. Not drinking enough fluids can lead to concentrated urine and increase the risk of kidney stones. Diet. Eating a diet high in protein, salt, and sugar can increase the risk of kidney stones. Medical conditions. Certain medical conditions such as gout, urinary tract infections, and inflammatory bowel disease can increase the risk of kidney stones. Medications. Certain medications such as diuretics, calcium-based antacids, and some antibiotics can increase the risk of kidney stones. Obesity. Being overweight or obese can increase the risk of kidney stones. Gender. Men are more likely to develop kidney stones than women. Age. The risk of kidney stones increases with age, with most cases occurring in people between the ages of 30 and 50. It is important to talk to your doctor about your risk factors for kidney stones and ways to prevent them. Kidney stone diagnosis. The diagnosis of kidney stones typically involves a combination of physical examination, medical history, urine and blood tests, and imaging studies. Here are some common steps involved in the diagnosis of kidney stones. Medical history. Your healthcare provider will ask about your symptoms, medical history, and family history of kidney stones. Physical examination. Your healthcare provider will perform a physical examination to check for tenderness in the abdomen or back. Urine and blood tests. Your urine may be tested for signs of infection or the presence of minerals that can form kidney stones. Blood tests may also be performed to check for signs of infection or abnormal kidney function. Imaging studies. Imaging tests such as X-rays, ultrasound, or CT scans can be used to detect the presence and location of kidney stones. In some cases, your healthcare provider may order additional tests or procedures to further evaluate the size and composition of the kidney stones or to identify any underlying conditions that may be contributing to their formation. Types of kidney stones. There are several types of kidney stones, which can vary in composition and can require different treatment approaches. The most common types of kidney stones include 1. Calcium stones. These are the most common type of kidney stones and are typically made up of calcium oxalate. They can also be made of calcium phosphate or a combination of both. 2. Uric acid stones. These stones form when the urine is too acidic and can be caused by a diet high in purines or conditions such as gout. 3. Struvite stones. These stones can form as a result of a urinary tract infection and can grow quickly and become large. 4. Cystine stones. These stones are rare and are caused by a genetic disorder that causes an excess of cystine in the urine. The type of kidney stone can be determined through laboratory analysis of a past stone or by collecting a urine sample to check for the presence of certain minerals. Treatment may depend on the type of stone, with some stones requiring dietary changes or medications, and others requiring more invasive procedures such as shockwave lithotripsy or surgical removal. Kidney stone treatment. The treatment for kidney stones depends on the size, location, and composition of the stone, as well as the severity of the symptoms. Some treatment options may include pain management. Pain medications such as ibuprofen or acetaminophen may be recommended to help manage pain. Hydration. Drinking plenty of fluids, especially water, can help flush out the kidney stones and prevent future stones from forming. Medications. Certain medications such as alpha blockers or diuretics may be prescribed to help facilitate the passing of kidney stones. Shock wave lithotripsy. This is a non-invasive procedure that uses shock waves to break up the kidney stones into smaller pieces that can be passed more easily. Ureteroscopy. This is a minimally invasive procedure that involves inserting a thin, flexible scope through the urethra and bladder to remove the stones. Percutaneous nephrolithotomy. This is a surgical procedure that involves making a small incision in the back to remove large kidney stones. Preventive measures. Making dietary changes, such as reducing intake of salt and animal protein, can help prevent future kidney stones from forming. It is important to talk to your doctor about the most appropriate treatment options for your specific situation, as well as ways to prevent future kidney stones. Kidney stone prevention. Preventing kidney stones involves making lifestyle changes and taking steps to reduce the risk factors associated with their formation. Here are some ways to prevent kidney stones. Stay hydrated. Drinking plenty of fluids, especially water, can help flush out the kidneys and prevent the concentration of minerals and salts that can lead to kidney stone formation. Dietary changes. Reducing the intake of salt, animal protein, and foods high in oxalates can help reduce the risk of kidney stones. Eating a diet rich in fruits, vegetables, and whole grains can also help prevent kidney stones. Medications. Depending on the type of kidney stone, medications such as thiazide diuretics, potassium citrate, or allopurinol may be prescribed to prevent future stones from forming. Monitor calcium intake. While calcium is an important nutrient, too much calcium can increase the risk of kidney stones. Talk to your healthcare provider about the appropriate amount of calcium for your individual needs. Manage underlying medical conditions. If you have a medical condition that increases the risk of kidney stones, such as gout or inflammatory bowel disease, it is important to manage the condition appropriately. Avoid dehydration. Avoid becoming dehydrated, especially during hot weather or while participating in activities that cause you to sweat heavily. By making these lifestyle changes and taking preventive measures, you can help reduce the risk of developing kidney stones and prevent complications associated with their formation. Kidney stone complications. Kidney stones can cause a variety of complications if left untreated or if they become too large to pass on their own. Some potential complications associated with kidney stones are: 1. Blockage of urine flow. Kidney stones can block the flow of urine, which can cause urine to back up into the kidney and lead to infection or damage to the kidney. 2. Urinary tract infection. If a kidney stone blocks the urinary tract, it can cause a urinary tract infection, which can lead to fever, chills, and other symptoms. 3. Recurrent kidney stones. Once you have had kidney stones, you are at an increased risk of developing them again in the future. 4. Kidney damage. Severe or recurrent kidney stones can cause permanent damage to the kidneys. 5. Sepsis. In rare cases, if an infection spreads from the urinary tract to the bloodstream, it can cause sepsis, a potentially life-threatening condition. If you are experiencing symptoms of kidney stones, it is important to seek medical attention to prevent complications and reduce the risk of future stones. With proper treatment and preventive measures, most people with kidney stones can prevent complications and lead healthy, normal lives.